G'day, Matt Maniacs. Have you ever wondered what is the true reason, what's the true cause of your patient and your client's issues? And if I could give you a technique, something that could basically be the cure-all and discover all the ills and all the problems with the people that you work with, wouldn't you take it? Well, I've got something just for you today because it's something that I only just recently kind of stumbled across, and maybe it's a bit naive of me to have only just found it, but it's called the 5 whys technique, and I think it just fits in so well with what we do here at Movement Assessment Technologies, and is really just a really useful process, and so simple a process for being able to really get down to the bottom of understanding what is the issue, what is the cause of your patient or your client's complaints. Now, this 5 whys technique might sound like something, if you've got children or something like that, might sound pretty familiar to maybe some of the ways in which they interact with you, asking why a lot. But if we really delve down and really ask why a lot, we can get down to the bottom of the issues that we're dealing with. Now, this is a technique that was developed by the Toyota Corporation and apparently is a big cornerstone in the way in which they interact. And it's very, very simple. As the name kind of implies, basically what we need to do is with any problem, we need to ask why at least 5 times to get down to the root cause of that issue. Right? Now, it might be a case of that we could ask why, a little bit less, or maybe we need to ask a little bit more. But I tried it myself because recently I've been doing a lot of running and I've managed to develop a little bit of an ITB kind of complaint myself. So a bit of pain in my lateral left knee. And so I just put myself to the test in terms of trying to ask why that's there, right? So I've been doing a lot of running, so I guess if we ask, why do I have ITB pain? Well, it's because I've been doing quite a bit. I'm out there running about 20 kilometers or so, and that's when that pain comes on about, right? So that ITB, it's overloaded, right? It's sore. And so why is that ITB overloaded? Well, it's because I've been running 20 kilometers. So that's 2 whys in there, right? But I'm running 20 kilometers, and obviously my that load is too high for what that can handle. So my next why then is, well, why is 20 kilometers too much? My third why, right? Now, if you've followed any of my kind of marathon progress, or if you know anything about me, my left leg, which is the side in which I'm getting my pain, is my weaker leg. Now, the only reason I know that is because of the objective assessment process that I've undertaken, which is very similar to what we put ourselves through and what we teach here at Movement Assessment Technology. So that's where then the power of objective assessment in being able to answer some of these whys becomes really important, right? So my 4th why then is, why is my left leg weaker? Well, I didn't probably do enough strength work. I knew that it was an issue a long time ago, and I probably didn't put enough emphasis and enough faith in being able to look after that one there. So I didn't do enough strength work in terms of addressing this left-sided weakness, and as well just inherent kind of training factors. The way I kind of move is probably the reason why my right side has always been the stronger side, and I always tend to use that a little bit more. But then I guess the root cause of the issue is, well, why didn't I do enough strength work? Well, the reason why was because I was probably a little bit too focused on other training, things that I maybe wanted to do a little bit more rather than addressing the underlying issues and the underlying problems. And I probably didn't engage myself enough as to the necessity in trying to work on these issues such a long time ago. Because this is about, kind of 8 months ago or so that I began, I guess, training in such a way. So it comes back to, okay, we asked the original question, why do I have ITB pain? But the actual inherent underlying root cause why is actually based in something that I should have been doing 6 to 8 months ago. And it just goes to show how being able to ask such detailed questions to really delve deep into why these issues arise can be so important. So I highly recommend with any of your patients or clients that you encounter to really get down to the bottom of it, really start to ask those why questions and go through at least 5 steps, 5 levels of asking why to be able to really start to uncover, I guess, these true root cause issues for your patients and clients. And particularly then the important part will be often somewhere in the middle of that, that's where you're going to have to start measuring. So that's where then utilizing tools like the MAT, the movement assessment tool, or any of the strength testing type tests that we teach in our course, or any of that objective assessment technology can be so helpful in being able to start to answer some of those deeper why questions as well. So give that one a go, guys. Remember, 5 whys. You got to ask that to get down to the root cause of the issue. I hope you have a great rest of your week. That's it from me.